Vaccination numbers are slowing here in Michigan. Your county numbers right here behind me are for 12 and up. So let's take a look. In Kent County, 56.4% of people have gotten their first dose. In Ottawa County, that number is at 58.2 and 60.9 for Kalamazoo County. Of course, that being among the higher and the bigger in our area. The statewide first dose tracker tracks those 16 and up and has Michigan sitting at 61.7% of residents with their first dose. And the presence of new variants officials. West Michigan now has 13 recorded cases of the Delta variant, and as experts fully expect those numbers to rise, we asked the second in command at the Department of Health and Human Services how bad it could get, and will Americans need more shots? It appears the country will miss President Biden's goal of getting 70% of American adults at least one dose by July 4th. With Independence Day fast approaching, it looks as if the number will be closer to 68%. 18 states have reached that 70% milestone individually, but Michigan isn't one of them. The president's staff, including Dr. Rachel Levine, now trying to outpace the spread of a new strain with the spread of information about vaccines.
The vaccines are safe. The vaccines are effective, and they're so important given the Delta variant. We are watching this variant very closely, and it has been increasing in the United States.
The Delta variant has been shown to be more contagious. Its effects worse than mutations before it. It spread to at least 77 countries, and the CDC says 1 in 4 COVID cases in the U.S. are now the Delta variant. As for West Michigan, according to data from the Michigan Health Department, 9 cases have been identified in Branch County, 1 each in Kalamazoo and Ottawa counties, and 2 in Berrien County. Really, who is most at risk because of it?
The people who are vulnerable to the Delta variant are those who have not yet been vaccinated.
Dr. Levine says the Pfizer and Moderna vaccines have been proven to protect against the strain, and studies to determine if the Johnson & Johnson shot does the same are ongoing. But by and large, the issue isn't with vaccinating adults. Dr. Levine says it's more in that 18 to 26 range.
Seem to be somewhat complacent that they will not suffer the negative effects of this virus. And that is incorrect. That is just wrong.
As for Americans who already got their shot, is there a chance people will need to get a booster, will need to get another COVID vaccine at some point?
We don't know if people are going to need a booster. We're looking at the results of further studies being done by the pharmaceutical companies. We're looking at all the data.
And they should know by the end of the summer, Dr. Levine tells me. And this week, the World Health Organization recommended continued use of a mask. Dr. Levine says that's a consideration they made on a global scale, as a lot of countries don't have a great vaccine supply. She says Americans who are vaccinated do not need to wear a mask.